Smoking gives you the immediate absorption into your system, and the edible products take about 3 hours and longer for your system to absorb and for them to be effective in addressing the nausea, the vomiting, the pain, and the appetite. And so our body has a natural system. Yes, you absolutely can.
We have programs on taking tobacco.
Yes.
How is it going to affect those programs by smoking marijuana?
Well, that's a really good question. And that's actually one of the questions that's being asked, is what legislation do we have to guide us in our thinking about the legalization of marijuana? And so there are different regulations and legal frameworks for alcohol, and there are different regulations and legalization laws related to tobacco use, right? And so tobacco use is there's a national standard. It applies everywhere across the country in terms of manufacturing tobacco. And in alcohol, though, it's province by territory. So laws differ, and it impacts on its use. And I know that's not exactly what you're asking. I'm getting there. And so the harm reduction pushback, often from our communities, is that we should not abuse substances and create a toxic environment for our spirit. That we should keep our bodies clean. Right. And so we don't promote alcohol use as acceptable, although in Canada now there are low-risk drinking guidelines that say there's a safe level of drinking. And what they're trying to do is to reverse our thinking that if we teach young people to use in moderation, that will prevent the abuse. Now, whether that really works with First Nations communities in the context of poverty and colonization and intergenerational trauma is open to question.
Doesn't go any further than what you're saying. Right now, we are huge when we burn smudge that we do marijuana. I just hope they don't mix it together and use it in the bad way.
Well, the they that you're talking about are both First Nations as well as non-First Nation people. Our own people, that's the colonization. Okay. I'm allergic to the smoke. I don't believe in that. We can't do that. In a First Nations work environment, that kind of medicine is sometimes not acceptable, right? So that has nothing to do with the legalization, but it has everything to do with our position as Indigenous people and our acceptance of medicine, our own medicines, first of all. Yeah, and so the potential for stigma, discrimination, and racism over the burning of sage and thinking that it's marijuana is high. I was helping a young couple in my community. They had twins, and so mom had breastfed both babies, and when she went to put the second one down, she noticed that the first one looked like she wasn't breathing. And so she panicked. And she picked the baby up and she tried to do everything she could for the baby. Called for help. Her next door neighbor came over. She asked her cousin who came from next door to light a smudge. And so they lit a big sage smudge and filled the whole house with the sage smudge. When the police got there, they assumed it was marijuana. And they treated her like an unfit mother in lots of different ways. And so the misunderstanding, both in our own community and Native, non-Native people, it's everywhere.